Good day! I am Maria Angelica BRN from BSN 2A. So for today, I'll be performing or demonstrating the proper procedure of chest physiotherapies, vibration, and percussion. But first, let me define what is percussion and vibration. So percussion is rhythmically striking the thorax with a cupped hand or mechanical device directly over the lung segment or segments to be drained. And it is also referred to as clapping, cupping, and tapotement. Meanwhile, vibration uses the application of fine tremulous action over the draining area. In this technique, a rapid vibratory impulse is transmitted through the chest wall from flattened hands of therapist by isometric alternate contractions of forearm, flexor, and extensor muscles. And then for the purposes, percussion and vibration is used to loosen and mobilize retained secretions that then can be expectorated or drained. And also it is to remove the air that is trapped in the lungs by slowing down respiratory rate and relieving shortness of breath. And then second is also to help strengthen the lungs and assist in emptying the lungs of retained carbon dioxide, and also to increase efficiency of ventilation and oxygenation. And lastly is to improve gas exchange and oxygenation. And for the materials or article needed, we only need towel. And then for the important considerations, so for percussion, so percussing with the hand held in a rigid dome-shaped position and the area over the lung lobes to be drained in rhythmic pattern. And then the patient is positioned in supine or prone and they should not experience any pain. And cupping is never done on bare skin or performed over surgical incisions below the ribs or over the spine or breast because of the danger of tissue damage. And typically, each area is percussed for 30 to 60 seconds several times a day. However, if the patient has tenacious secretions, the area must be percussed for 3 to 5 minutes several times a day. And at the same time, the use of forceful expiration during pursed-lip breathing must be avoided. Forceful expiration while the lip is pursed can increase turbulence in the airways, which can cause restrictions of small bronchioles. And then avoid excessive use of abdominal muscles. And lastly, allow the patient to perform deep breathing for 3 or 4 inspirations and expirations at a time to avoid hyperventilation. And then for the vibration, the important considerations in vibration. So vibration at a rate of 200 per minute is done several times or can be done several times a day. And to avoid patient causing discomfort, vibration is never done over the patient's chest, spine, breast, sternum, and rib cage. And then lastly, vibration is used after percussion to increase the turbulence of the exhaled air thus loosen thick mucus or secretions. So it is often done alternately with percussion. For the procedures, first, introduce yourself, explain the procedure to the client and why it is necessary. Good day, ma'am.
Day.
I am Maria Angelica Biorean po, a student nurse from Southern Luzon State University. And ngayon po, ma'am, ay gagawin ko po is tinatawag na chest physiotherapy, kung saan kailangan po nating tanggalin yung problema sa inyong na nakabara sa inyo para magkaroon po kayo ng maayos na paghinga. Okay po ba yun, ma'am? Okay po. So, mamaya po, kailangan ko pong itap yung chest nyo at kailangan ko din po itong i-vibrate. So, next, instruct the patient to use diaphragmatic breathing. So, bali ma'am, ganito po muna, inhale, exhale po muna kayo. Ang inhale nyo po is malalim at dahan-dahan. Tapos, inhale po ay sa nose or sa ilong. And then, exhale po kayo is sa mouth. Which is, dahan-dahan lang din po. Parang ganito po. Kailangan po is galing dito or dapat kasama po ang abdominal muscles nyo po para mas maging relax po kayo. Okay po ma'am. Kayo nga po ma'am. Inhale. Exhale. Exhale. Ayan, ganun po. And then, position the patient in prescribed postural drainage position. So dahil po ang affected area po is sa may chest. So, yan po ang inyong pwesto. And then, spine should be straight to promote rib cage expansion. So, straight naman po si ma'am. And then, for the percussion, first, cover the area or cover the affected area with gown or towel to reduce discomfort. And then, ask the client to breathe slowly and deeply to promote relaxation. So, ma'am, inhale, exhale po ulit kayo katulad nung kanina. Inhale po. And then exhale. Inhale. And then exhale. Ayan, okay po. And then now, alternately flex and extend the wrist rapidly to slap the chest. So, flex and extend to slap the chest. And then now, percuss or clap with cup hands on the chest wall for affected area or for each affected lung segment for 1 to 2 minutes and over 5 minutes for each affected lung segment for cystic fibrosis. So, remember to avoid clapping or percussing on the spine, liver, spleen, breast, scapula, clavicular or sternum. And then, so, ma'am, gagawin ko na po yung sa chest nyo or itatap ko po. And sabihin nyo lang po kapag hindi po kayo komportable or parang may nararamdaman kayong pain. So, percuss, extend, and sa other naman po, sa kabila. Okay. And then, instruct the client to inhale slowly and deeply. So, inhale, exhale po ulit kayo. Inhale, and then exhale po. Okay, dandan inhale po ulit. And then exhale po. Okay, so, for the vibration, vibrate the chest wall as the patient exhales through pursed lips. So, ma'am, bali ganito po, may tuturo po ulit ako na inhale, exhale. Sa process naman po na ito, ma'am, inhale po kayo ng dahan-dahan at malalim sa nose po. And then exhale po kayo is yung parang nakanguso or yung parang sumisipol po kayo. Ganun lang po habang binabibrate ko po kayo or habang ginagawa ko yung procedure. Inhale, exhale lang po. Parang pag ginagawa ko po yun, gaganto ka lang po. Yun po ay tuloy-tuloy habang ginagawa ko po yung process. Pero sasabihin ko po sa inyo kung kailan mag-start. So, and then, cover ko na lang din po. Cover ko po ulit itong towel. So, cover the area to reduce discomfort. So, bale ma'am, may bibigay po ulit ang tissue paper which is para po magamit nyo mamaya. Kakailanganin nyo din po ito mamaya pag sasabihin ko pong umubo na kayo. And then, so, ngayon, for the next procedure, next step, place the hands with palm down on the chest wall or on the area to be drained. So, and then the other hand on top of the other with fingers together and extended or alternatively. And then hands may be placed side by side. So if two lungs will be if two area will be vibrated, pwede pong side by side or by placing the other hand on top of the other affected area or hands on each side of the rib cage. So, but I'll be using this technique or position wherein yung other hand is naka-place sa ibabaw ng other hand. And then, now, tense the, so by placing the other hand and tense the muscles while applying moderate pressure downward and vibrate arms and hands. So the rationale of this is to relieve pressure on the thorax when the patient inhales. So after also encourage the patient to cough after 3 or 4 vibrations. So bali ma'am, dahil may hawak na po kayong tissue na binigay ko po sa inyo, ito po ay sasabihin ko po sa inyo kung kailan kayo uubo. After ko po mag-vibrate sa inyo after 3 or 4 na ganito po. Okay po ba? So bali, sabihin ko naman po sa inyo kung uubo na po kayo. Eh di ma'am, pwede nyo na pong gawin yung inhale-exhale na ang pag-exhale nyo po is yung parang nakamuso. Inhale-exhale na po kayo. Sige ma'am, ubo na po. Okay, so sa kabila naman po ma'am. Inhale, exhale na lang din po ulit kayo na parang nakamuso po. Okay po ma'am, ubo na po. Okay, so ilagay niyo na lang po dito ma'am yan. And then, now, allow the patient to rest for several times. So ma'am, rest po muna kayo. And then, babalik po ako para i-check po ulit kayo. Titatapon ko lang po ito. Mga after 2 to 3 minutes po, babalik po ako. Sige po ma'am. So, ma'am, nakarest na po ba kayo? Bali ngayon, ma'am, i-check ko na po ulit ang breath sounds nyo. Pwede po kayong umupo muna. Kaya nyo po ba? Upo po muna kayo. And, For the next procedure, listen with stethoscope for changes in breath sounds. Inhale, exhale. Hinga lang po kayo, yung tamang hinga lang po, yung normal po. Okay po. Okay po, okay na po ma'am. And then, for the last procedure, repeat the percussion and vibration cycle, or repeat the vibration and percussion cycle according to patient's tolerance and clinical response, about 15 to 30 minutes. And yun ma'am, okay na po. Thank you po. Update ko na lang po kayo sa doctor's order po, or kung ano pong masasabi po ng doctor nyo. Thank you po, and rest na po kayo. And then for the documentation, document the rate, depth, and character of respiration. And then also document the breath sounds heard and other placement of sounds. And lastly, document any signs and symptoms of respiratory distress.